Bismillahir Rahmanir Rahim. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. Welcome back. I'm Dr. Hambacha, PhD Diagnostic Ultrasound Associate Professor. So today we'll talk about the scattering. Right, in this session we'll talk about the scattering. So by definition, what is scattering? The size of the when the size of the reflector is smaller than the wavelength of incident sound wave, then that is called scatter. So here you can see in this image, this is the size of the reflector, which is like this one. Sorry for disturbance. So if the size of the reflector is smaller than the wavelength of the incident sound wave, then that is called scatter, and the sound wave will be scattered from that reflector. The sound wave will move in different direction. The sound wave will be redirected if they strike a small reflector. For example, cells in the organ parenchyma. You are just imagining, you can see the liver, the thyroid, the breast, the testes, and other organ parenchyma. You can see that there will be scattering. And the scattered sound waves interfere with each other, result in constructive destructive wave interference, which you have already discussed about that. So if the size of the reflector is smaller than the wavelength of incident sound wave, then that will be scattering. And here you can see, in the case of the scattering, the sound waves are redirected in multiple directions and they are moving in different paths. So what are the factors that responsible are that determine the strength of the scattered echo? So these are the frequency of the sound wave, scatter density, size of the scatter, and the acoustic impedance mismatch. So first of all, we are going towards the frequency. There is a direct relation between the frequency and the scattering. If the frequency is increased, then the amount of scattering will also be increased. This is a direct relation, one-to-one relation, right? Now, a question arises that with the increase in frequency, the wavelength of the sound wave will reduce, and it can reach to that extent that the wavelength of the sound wave can be smaller than the size of the incident, the size of the reflector. So in that case, it will no longer be scattering, and we are talking about the scattering, right? So in the case of scattering, if the frequency is increased, then the scattering will also be increased. So you can say that there is a direct relation between the scattering and the in the frequency. Then there is another factor which is scatter density. So with the increase in the scatter density, by scatter density, I mean that if there is a unit volume and the amount of the scatter, the number of the scatter in that unit volume is called scatter density, right? This is a density containing a number of molecule. So if there is only one molecule, right? So there will be only one scattering from that. But if the number of molecule increase to two, then the scattering will also become twice. So the scattering is directly related to the scatter density. Scatter density and scattering are directly related to each other. Then the scatter size. If the size of the scatter is increased, then again the scattering will increase. So by this increase, it doesn't mean that the size of the scatter will be increased to such an extent that it will become a specular reflector. But I mean that the size of if the size of the reflector is smaller, then there will be scattering, but that scattering will be smaller enough. But if the size of the reflector is, for example, it's increased by a factor of 2, it become twice, then the scattering will also become twice. So again, you can say that there is a direct relation between the scatter size and the scattering, and this is a direct one-to-one relation, linear relation, right? Then acoustic impedance mismatch of the scattering medium. If the acoustic impedance mismatch of the scattering medium is increased, then again you can say that the scattering will also be increased, because here you can see the scatter is a small reflector and it's separated from its surrounding by its acoustic, by the difference in the acoustic impedance of the scatter and the other scatter or other medium beside that scatter. So if the acoustic impedance of both the medium is different from each other, there will be a strong scatter over there and there will be strong scattering. So again, you can say that there is a direct relation between the acoustic impedance mismatch and the scattering. So all these were factors which were affecting the scattering. If you have any question related to the scattering, then you can ask after the session. I will give you time for the question and answer. Uh, uh, so it was all about the scattering. There is a special kind of scattering which is called relay scattering, right? That is important. So in the case of relay scattering, this one, the size of the scatter will be smaller enough, that will be substantially smaller than the wavelength of the incident sound wave. Just for example, if you are using 4 megahertz frequency, then the wavelength of the 4 megahertz frequency will be about 1 mm, right? So 1 mm is large enough as compared to the size of the RBC. The RBC size in micrometer, but that of wavelength of the 4 megahertz frequency is in millimeter. So there is a huge difference between the size of the relay scatter and the incident sound wave. So this kind of scattering is called relay scattering. And in the case of relay scattering, the relay scattering equals is proportional to the fourth power of the frequency. For example, if the frequency is increased by a factor of 2, then the relay scattering will increase by a factor of 16. So here you can see this is 2 raised to the power 4. This is not 24, right? And this is equal to 16. So the scattering will be 16 times. And this is in the case of relay scattering. This is at most important for the examination point of view. Now, we are coming across the terminology which is the fruit of the ultrasound physics and instrumentation till now, because this terminology can be used not only in the in reporting which you are making, but it is also important for those individuals which who are not directly related with the ultrasound imaging, but they are going to interpret the report of the patient. So it's at most important. The terminology can be learned to hear with very easy way. So first of all, we are going towards the echogenicity, right? The echogenicity is a term which can be which is frequently used in the ultrasound reports. So now a question arises: what is echogenicity? So if we analyze this term, echo and genicity, by echo we mean the sound waves which are reflected from a reflector. The reflected sound waves are called echo. And genicity means generation, echo generation. So how the echo can be generated? That depends upon the strength of the reflector. If there is a strong reflector, then strong echo will be generated from that reflector. So the echoes that are received by the transducer and displayed on the display of the ultrasound machine, that can be displayed in brightness. So if the strong amplitude echo are received, then it will be displayed bright on the display and vice versa. So it's mean we can, in other words, say echogenicity as brightness. Although if you search the meaning of echogenicity in dictionary, there will be no meaning of echogenicity as brightness. But in the case of ultrasound, you know that we are going to evaluate structure with the help of these echoes, and when there are strong echoes reflecting from a reflector, that will be bright on the screen, and if the echo amplitude is lower, then it will appear dark. So that's why we are calling it as brightness, right? So here in this image you can see there are some structure. This is an ultrasound image of the urinary bladder and the prostate. So here you can see the structure which can generate sound waves. They are echogenic. They are said to be echogenic, right? Now, under the umbrella of ecogenicity, there are a number of other terms that can be used. So the first term is anechoic. So what do you mean by anechoic? By anechoic mean we mean that an mean without echo mean mm, ecogenicity so sound waves, reflected sound waves. So if there is any structure and that is unable to reflect sound wave, that will appear dark or black on the screen. Then there will appear, output any structure which can generate sound wave or the such extent contribution present are in already. For example, you know that this would describe the that it needs to depends upon the gain as well. If you increase the gain, the equilibrium, the evaluating construct gain that there from the structure. Then you can give the results of that thing which that is there was. But again, I will tell you that something or some structure will appear to you as more ecogenic, but that will appear to someone else as less ecogenic. So that's why this is subjective. But in the state of the art, cutting edge modalities, there is artificial intelligence in the machines, and now the machine have a number of images and ecogenicities in the database. So if you select a specific database, for example, you are evaluating the liver, so the machine will have a number of images in its database, and the liver which you are going to evaluate will be compared with the database, and the machine will give you either the liver is hyperechoic or hypoechoic or isoechoic, right? And then in that case, that will be objective, and objectively, it will give the same result to either novice examiner or expert examiner. They will get the same results. But for the time being, The ecogenicity which we are going to use in our daily examinations, that is subjective. That's why I will advise you to not rely much more only merely on the ecogenicity. Then another term which is used over here is hypoechoic. So the hypo prefix is attached with the echo, and by hypo we mean that low echo. Any structure that generates echo with low amplitude, that will appear dark, and that darkness is directly related to the echo amplitude or the acoustic impedance mismatch of the medium. So that will appear slightly hypoechoic, but again you will have to use this term in comparison with other structure. For example, you can say this region appear hypoechoic to this region, right? Because the cystic structure render posterior acoustic enhancement, and this enhanced region appear hyperechoic as compared to the surrounding tissue. So you can say that there is a cystic structure having posterior acoustic enhancement, and the enhanced region is hyperechoic to the adjacent area. The adjacent area is hypoechoic to the enhancement rendered by the cystic structure. So I think it was enough exposition. Then we have another term which is isoechoic. So here you can see iso prefix is used with echo. So by iso we mean that the same. So any structure having the same echogenicity is said to be isoechoic. For example, you can say that the renal parenchyma is isoechoic to the diaphragm. Or you can say that there is a structure, or there is artifact above, just above the diaphragm, of isoechoic with the liver. So this is mirror image of the liver, right? We'll discuss it in the artifacts. So here you can see this is true liver just below the diaphragm, but you can see above the diaphragm the same echoes isoechoic structure appear above the diaphragm, but above the diaphragm normally there are lungs. But what is that? So this is the mirror image of the liver, isoechoic to the normal liver parenchyma. Right. So the isoechoic can also be used. And describing a pathological structure, you can use isoechoic, hypoechoic, hyperechoic, and so on. For example, there is a mass in the right lobe of the liver, and the mass is more echogenic, bright. So you can describe that there is a well-defined or ill-defined. So the well-defined, ill-defined terms can be used if the structure is differentiated easily from the rest of the surrounding tissue, then it's mean it's well-defined. But if it is difficult to differentiate the structure of interest from the surrounding tissue, then it is said to be ill-defined, right? So either well-defined or ill-defined structure is seen. Measuring this one, you will measure the structure as well. And the right lobe of the liver, either in the sixth segment, seventh segment, or eighth segment, or a fifth segment. So you'll have to segmentally describe the pathological structure. Was that segmental different description effect on the management plan as well? So that's why you will have to localize the structure, and then you can set either it is hyperechoic to the normal liver parenchyma, hypoechoic to the normal liver parenchyma, or isoechoic to the normal liver parenchyma. So these terms can be used in the ultrasound reporting, and not only to perform the ultrasound and then you are going to make the report, but it is also important for those individuals who are general physicians, who are surgeons, who are in any field, they are specialists, but they are going to, even you are student, but it's important for you, for a medical student as well. For example, any student, he is learning here in the university, and he came back to village, and there is a patient and performed an ultrasound, he will have some expectation with you that our kid will come back and I'll show my report to him or her, and they will interpret it to me. And whenever the patient gave you the report, and then you will have to interpret it. That's why this terminology is important for those individuals as well who are not directly related to the ultrasound. Then we have another term which is texture, right? So you know about the texture. The texture means the distribution of echo on the display is called texture. So the texture could either be isoechoic, homogeneous, or heterogeneous. Sorry. So by homogeneous echo texture, we mean that all the echoes are arranged smoothly. So that smooth arrangement of echo on the display is called homogeneous. But if the echoes are heterogeneously or roughly arranged on the display, then that will be heterogeneous. So here you can see this is a homogeneous echo texture, right? So all the structure appear at the same echogenicity. So this is homogeneous. But if it appear heterogeneous, mean roughly arranged. So here you can see this is a rough appearance of the structure. So this is called heterogeneous. So again, you will have to describe that particular pathology. For example, you're performing ultrasound and you say that there is a well-defined or ill-defined mass in the right lobe of the liver. It is homogeneously echogenic or heterogeneously echogenic. So by this homogeneous heterogeneous, you mean that the echoes on the display are either smoothly arranged or roughly arranged, right? Then there is a special kind of texture distribution of echoes on the display, which is called speckle pattern. So by speckle pattern, mean that if there is alternative hyperechoic and hypoechoic dots, so this dotted pattern is called speckle pattern. Now you can see this there is a special kind of texture which is called speckle pattern. So by speckle pattern we mean that dotted appearance, and that is the response of the constructive and destructive wave interference. You know that in organ parenchyma there will happen interference. So that interference will either be constructive wave interference or destructive wave interference. But here you can see again, you will have to describe the structure in terms of speckle pattern. Just for example, here you can see this is a lever which appear in speckle pattern. But in the previous machines, for example, and the old machines, this speckle pattern was too common. But in the state of the art, cutting edge modalities nowadays, this is reduced to a greater extent with the help of compound imaging and a number of other functions which are in the machine. That's why you will not have too much speckles in the state of the art modalities. But still, if some structure appear like this, so that will be described as speckle. For example, you are going to buy a machine, so the engineer will show you the person the vendor will tell you that this is too good machine, and you can see but that time whenever you observe you will see the speckle. So you can say the vendor that there are a number of speckles in this imaging. That's why this is not a good machine. So because in the state of the art modalities that speckle pattern is reduced to a greater extent, right? So it was all about terminology, but there are some special terms which you are going to use in the ultrasound report. You will have to differentiate between a solid and a cystic structure. and you know already about the differentiation of the solid and cystic structure. But here you can see this is a cystic structure having posterior acoustic enhancement. So always if there is posterior acoustic enhancement of a structure, the structure by itself will appear black, but it will render posterior acoustic enhancement, so that will be cystic structure. But in contrast, if the structure by itself appear bright, but it render posterior acoustic shadow. So here you can see there is a night behind a strong reflector, because this is strong attenuator. All the sound wave which enter the structure, they will be attenuated. But in the case of this structure, they will be through transmission. All the sound wave will pass through it without attenuation. And strong sound wave will reach this region, and strong echoes will reflect back from, although the nature of this tissue is similar to the nature of this tissue. The nature of both the tissues anatomically, naturally, they are the same, but they appear at, at different echogenicity, because the sound wave which are passing through a cystic structure, they are not attenuated, but all the sound wave which are transmitted through soft tissue, they will have the average attenuation of zero point 0.5 decibel per centimeter per megahertz. So that's why they will appear dark as compared to the enhancement. So you'll have to differentiate between the solid and the cystic structure by its posterior acoustic enhancement or acoustic shadow. If any structure which render enhancement, that will be cystic, and those structure which render shadow, that will be solid. Now you'll have to now you know about the basics of the acoustic enhancement and the acoustic shadow, so you will know more be blind imitator. But you should know about the mechanism of the acoustic enhancement and the acoustic shadow, so you can easily describe. For example, if there is any mass in the uterus, the mass will appear at the same echogenicity as that of the myometrium, but if it render posterior acoustic shadow, it's mean that is highly attenuating structure. Similarly, if there appear any structure that is hypoechoic, but it render posterior acoustic shadow, so again that will be highly attenuating. So some of the structure would be like this as well, that by itself it will hypoechoic, and the same it will render posterior acoustic shadow as well, because the structure will be highly attenuating. But mostly highly attenuating structure are bright itself. Just for example, stone in the kidney, so the kidney stone will appear hyperechoic and it will render posterior acoustic shadow. But if there is any cystic structure, for example, this is ovarian structure, cyst, renal parenchymal cyst, there is any cyst in the liver, you can say normal anatomic structure, for example, urinary bladder or gallbladder or so on, because these are fluid-filled structure and fluid have low attenuation for the sound waves. That's why it will have posterior acoustic enhancement. Then we have another topic which is refraction. So that will be discussed in the next session, right? So that's because we can't finish it in the same session.